Okay, let's talk about something that makes any cat owner's heart just plummet. Finding blood in the litter box. It's one of those moments that's instantly alarming and your mind just goes to the worst case scenario, right? So if you're watching this, you've probably just had that heart-stopping moment. And you know what? It is totally normal to be worried. Seeing blood where it definitely shouldn't be is a huge signal that something's not right. But here's the thing. The absolute key right now is to turn that worry into action. So take a deep breath. We're going to break down exactly what you're seeing, what it might mean, and what you need to do next. First things first, you've got to put on your detective hat. Seriously. The way the blood looks is actually the #1 clue your vet is going to ask about, because it tells a story about where in your cat's digestive system the trouble is. And really, it boils down to two main types. On one side, you've got haematochezia. That's the bright, fresh red stuff. When you see this, it means the bleeding is happening somewhere near the exit. You know, the colon, rectum, that area. But on the other hand, there's melena. This looks black, kind of like tar, because the blood is coming from way higher up, like the stomach or small intestine, and it's been digested. So just remember this. Bright red means lower, and black and tarry means upper. It's a huge first clue. And sometimes the details get even more specific. Is the blood mixed in with mucus? That often points to irritation in the large intestine. Or maybe it's more like watery, bloody diarrhea. Or you're seeing these dark, jelly-like clots. Every single one of these observations adds another piece to the puzzle for your vet. So take a mental note, or honestly, it might feel a bit weird, but snapping a quick, discreet photo can be incredibly helpful. All right, let's get to the million-dollar question. What is causing this? Well, the list of possibilities is pretty long, but it ranges from really common, easily fixable things all the way to more serious conditions. Let's start with the common stuff first. A lot of the time, the culprit is something pretty simple. Did you just change their food brand without a slow transition? Cats have sensitive stomachs. Has something stressful happened lately? A move, a new pet? Stress-induced colitis is absolutely a thing. Even something as simple as constipation can cause a little bleeding from the strain. And of course, parasites are a super common cause, especially in kittens, and thankfully, that's usually straightforward to treat. But then, of course, we have to talk about the more serious possibilities. Things like inflammatory bowel disease, different kinds of infections, or maybe they swallowed something they shouldn't have. And this right here, this is exactly why you can't just guess or wait and see. A trip to the vet is absolutely crucial to rule these bigger issues out. Okay, this brings us to a really, really critical point. You've seen blood. So, is this a call the vet in the morning situation, or is this an everybody in the car, we're going to the emergency clinic right now situation? Let's go over the red flags. Please pay close attention here. If your cat has bloody stool and any of these other signs, it is an emergency. We're talking about a large amount of blood, not just a streak. Pale gums, which can be a sign of shock or anemia. If they're super weak or lethargic, if they're also vomiting, or if their belly seems swollen or painful, these are all signs that your cat needs help immediately. Don't wait. Now, what if your cat seems totally fine? You know, they're eating, drinking, playing, chasing that laser pointer like nothing is wrong, and you've only seen a little bit of blood. In that case, you can probably schedule an appointment with your regular vet. But here's the key. You still have to make that call. The bottom line is you never, ever just ignore blood in the stool. So you're on your way to the vet. And I get it, that can be stressful for you and your cat. But knowing what to expect can really help take the edge off. Your vet's goal is to find the root cause, and they have a very logical way of doing it. First, the vet is going to talk to you. All those detective notes you took, this is where they become vital. They'll ask about diet, stress, everything. Then comes a thorough physical exam, nose to tail. After that, they'll probably recommend some tests, usually starting with a fecal sample to look for parasites and blood work to check on organ health and look for signs of anemia. And if they need a closer look, they might move on to imaging. And that's where something like this comes in. An ultrasound is an incredible tool because it's totally non-invasive and lets the vet literally see inside your cat's abdomen. They can look for stuff like a swallowed object, check for inflammation in the intestinal walls, or spot other issues that you just can't find with a physical exam or blood tests alone. So, once your cat has a diagnosis and is on the mend, the whole conversation starts to shift. It becomes less about fixing a problem and more about, okay, how do we support their gut health and prevent this from ever happening again? And you know, there are some really powerful, simple things you can do. Consistency is everything, especially with their diet.
always transition to a new food slowly, keep up with routine deworming, and those annual wellness checks. And don't ever underestimate the power of a low-stress home. Plenty of toys, scratching posts, and safe spaces can make a huge difference for their entire body, including their gut.
And here's a term you might hear from your vet, symbiotics. It sounds super scientific, but the idea is actually pretty simple. Think of it as a power combo for the gut. You have the probiotics, that's the good, beneficial bacteria, and then you have the prebiotics, which is basically the food that helps those good bacteria thrive. Together, they work to get that healthy gut balance back on track.
So if there's one single thing you take away from all of this, let it be this. That initial jolt of fear you feel, that's your cue to become a careful observer and a proactive partner in your cat's health. Pay attention to the details, check for those red flags we talked about, and always, always make that call to your veterinarian. They are, without a doubt, your best ally in keeping your cat healthy and safe.